Hi everybody, welcome to Downward Dog Rising. I'm going to give you a quick workout tonight to help strengthen your core, therefore stabilize your spine, and also give you some stability through hips, pelvis by strengthening your lateral thighs and your glutes. So if you feel like your glutes are weak, if you feel like your core is weak, and if you get back pain, then maybe you should try this workout. All right, let's begin. Lie on your back. Feet are going to go hip width apart. I want your spine neutral so your back is flat against the mat. And then if you could take one knee up at a time, breathe in. Exhale, make sure you don't lift your low back off the mat. Toe taps. Inhale, exhale. Inhale, exhale. You want to feel the abdominal wall really deepen into your low back. 7, 6, head stretches away from tailbone. 5 and 4. Feel the deep abdominals scooping in. 3 and 2. Last one. Switch sides, little toe taps. Breathe in. So what we're looking for, the hips, the pelvis are still, they're stable. Crease the hip. So if you don't have stability, okay, you're going to be like moving around like that. We don't want that. Stay stable. Tighten your core in. 5. Tighten all the way across. Scoop in. Zip up. Feel the deep core connection. 3 more. 2 more. Nothing moves but the leg. Last one. All right. Now, width across collarbones. Chest is open. We're not going to put pressure in the neck. Do a little chin nod, head yes. Just go up, and down. Create awareness. Release at base of skull, occiput. Come back center. All right, now float your arms up. Lift your shoulder blades, the scapula away from the mat, away from the center of your spine. Drop them down. Lift them up, create awareness, drop them down. Make room, mid-back. 5, 4, they lift up, they lower down, they lift up, they lower down, and 3. Create some space in there. 2 more, last one, so you can bridge without compression. Arms reach long, head lengthens away from tailbone. This is back arching. I'll move my arms. When your back arches, your hip bones lift up, and then they go higher than your pubic bone, and you're arched. Sway back. We don't want that. Pull your abdominal wall in. Bring your hip bones back. If you imprint your spine, it's going to feel a little better in the beginning of strengthening your core. Arching is going to load your spine. We don't want that. So either you're going to imprint or you're going to find your neutral, which is between arching and flat back. Neutral, natural curve of spine. The 2 hip bones are in the same line as the pubic bone. You're safe if you can align the landmarks of your body, then you're safe. Okay, reach the arms long. Inhale, tighten your core. Prepare, stretch the spine long. Press into all 4 corners of your feet. No weight in your neck. Stretch the front of those hips and thighs to the sky and lower down. Maybe lift this high because you have back pain and that's what your core can support, and that's fine. Just lift that high. No big deal. Maybe you're strengthening, you're pressing into the hips to stretch the quads, the hip flexors, so you lift a little higher, and that's fine too. Lift up, collarbones open wide, no weight in neck. Come back to mat. 7, stretch that tailbone, engage both of your glutes. Lengthen the front of those quads. Hip flexors are up here. Quads lengthen and down. Core is strong. And 6, stabilize your spine. and down, and 5, lift up, lower, down, 4, lift, and down, and 3, 2 more, lift and down, last one, lift and down. All right, so if your hip flexors are super duper tight and you need to release the front of your hip, the 2 hip bones face the sky, the anterior superior iliac spines. Peel them back, posterior pelvic tilt, that's imprinting spine into mat. You would hold your pelvis in an imprinted position, posterior pelvic tilt. That is going to provide an angle to give the hip flexor a greater stretch. So then your next thing, how far can you slide your leg out without losing your posterior pelvic tilt? Slide the leg out, pull it in. Say you're super tight, you slide your leg out and boom, that happens. You've lost the posterior tilt. Tailbone long, scoop your core. The opening happens when you keep the pelvis tilted back and it stretches this part out here. And then over time, do like 6 more. See if you can get the heel to touch and extend the leg. I'm able to keep my hips back. 5. Inhale, exhale. 4. Inhale, exhale. Feel the front of that hip. 3 and 2. Last one. Take a break. Hug knees in. Relax your spine. Inhale, exhale. Let that low back fall into the mat. Low back just drops in. Then we're going to do the other side. So start over. Posterior pelvic tilt. Hip bones roll back to navel. Low back imprints mat. Take the other leg, heel slide down. Slide as far as you can without pulling out of that posterior tilt. Maybe you have it right away, maybe it takes a few tries. Maybe you don't get there. You know what? That's fine. You start with wherever you're at and you build. Keep the hip bones where they're at. Slide. Pelvis is stable. Exhale. Inhale. 4 more. Exhale. 3 more. Inhale. Exhale. 2 more. Last one. All right, you did it. Come back in. All right, so that helped release the front of the hips. Here's one more. This next one, your transversus abdominis muscle, is a horizontal muscle. All right, we want to think of a belt pulling really tight across, and it's below your rectus abdominis. We want to pull all the way across, and then we're also going to feel a little bit around here. Narrow the 2 hip bones together. Now, let one knee drop to the side, and what I want you to do, your 2 hip bones stay straight to the ceiling. If you let your knee sway sideways and you go like that and your pelvis rotates, you just twisted your spine, and I'm not looking to twist your spine. Your hips face up, narrow the hip bones together, like think of a line, tighten it across. Your knee goes to the side, your hips stay straight to the sky. Your knee goes to the side, tighten your core in. We want stability through your spine and pelvis. 8, 7, 6. If you have back pain, this will help you. 5. Make sure you don't arch your back. 4 and 3, 2, last one. Okay, drop the other knee. Tighten those 2 hip points all the way in. Tighten core to spine, transversus. Exhale back. Keep hips to sky. Exhale back. This one's less stable. I have more motion. Exhale back. 6 and 5. Narrow the hip bones together. 4 and 3. Exhale. Pull those hip bones together. 2 more. And last one. All right. So that will help you keep hips stable. And I wanted to do that. So now I want you to turn to your side. Level 1. Stay on your bottom arm. And just relax your neck so it doesn't feel like your neck works too hard. And then what I'm going to ask you to do is just straighten out your legs. You could either have yourself propped up or you could be on your arm. Now this first one, I want you to lift the leg, lower the leg without rolling your hip bones back. So, top hand presses into mat. You're going to lift and down. Lift, down. Your hips are aligned. Lift, down. And 7, and 6, and 5. Neck is long. 4, and 3, and 2. Lift and lower. Last one. Now, from the top of your femur bone, turn out just a little bit. Your hip bone rolls out. If this hurts your knee, go back to parallel. Avoid turn out. Turn out, lift, and down. Control, scoop in, lift, and down. Control, scoop in, lift, and down. 8, lift, nothing moves but the legs. 7, shoulder out of ear. 6, 5, and 4, 3, lift and down. Just move leg. 2. Last one. Maybe your range looks different. Maybe your range is here without moving pelvis. And that's where you're at, and that's great. That's where you want to be. Okay, now, hand to hip, swing back. Avoid rolling your hips forward, your ribs losing contact. Rib cage, pelvis connection. Integrate the two together. And then you could either have a hand at hip, hand in front. Relax the shoulder, maybe reach the arm up. And then maybe you'll do a little pendulum. Create space right there. Can you swing your leg forward and swing your leg back? This will also strengthen your hip. If you've had knee surgery, knee replacement, you can strengthen the side of your hip and thigh, because we need our side of our hips and thighs to be strong for our gait when we're walking, when we balance. Forward and back. Relax that shoulder out of your ear. Forward and back. Tighten core to low back. Forward, flex the foot. Inhale, point. 3 more. Forward and back. 2 more. Forward and back. Last one. Now you're going to lightly brush ankles without moving either side of your pelvis, without moving your hips. Point toes. Inhale. Exhale. Circle around. A smaller circle would look like this. Tighten your core to your spine. Avoid moving pelvis. And 7, circle around. And 6, circle around. 5, and 4. Maybe you're up here. You could also be up here on the elbow. Those bottom ribs lift up. 3, and 2. Reverse. Notice how I'm not moving the entire body. I'm just doing circles with my leg. 9, and 8. My oblique slings wrap to the center. 7, and 6, and 5. You could do a smaller circle if you feel your pelvis move. 3, and 2. Last one. All right. We're going to do one more thing. Our bottom obliques, we want to feel like we can lift them up off the mat. We're going to straighten out both legs. Single file line. Lift the legs up. Hold here. Lower the legs down. Lift up. Stretch long. Lower down. Feel some space in there. And 8. Lift and down. 7. Lift and down. And 6. And 5. Get those obliques. Wrap. Feel that connection. 4. And 3. And 2. Last one. Hold it here. Now kick. Little glute kicks. Can you keep your pelvis stable as you kick? Legs forward, back, forward, back, forward, back. Squeeze your glutes, tighten your core. And 8, and 7, and 6. Maybe go slow. 5, and 4. Legs are straight. 3, and 2. Last one. Feel that space in there. All right. Next, turn onto your back. Cross the leg that you just worked. Whatever leg was on top, my right leg, that ankle crosses over the knee. Stretch ribs and hips apart. Lift up. And you would just press that inner thigh outward. Get that lateral rotation of that thigh bone. And just relax for a moment. Flex your heels for a deeper release through your hips. And breathe in. And breathe out. Breathe in. And breathe out. One more time, breathing in. And breathing out. Awesome. Take both legs up in the air. And just to release those knees, maybe bend in, press back out. Just get a little motion through the legs. Bend in, press back out. Bend in, press back out. Bend in, press back out. And then if your knees feel okay, if your back feels okay, maybe slide your hands under pelvis, not totally under the center of your pelvis, just along the sides for extra lumbar back support. And then maybe you'll just lower the legs wherever you can without the back lifting off the mat. Maybe you'll bend the knees and then circle up. Keep back on mat. Lengthen, circle up. If you feel your back lifting, do leg reaches at a higher diagonal. Inhale, exhale, tighten core. Inhale, exhale, back is long. Head away from tailbone, strengthen your spine. And then if you have severe back pain or things going on actively, you wouldn't do it like that. What you would do is tighten your core as much as you possibly can, like crazy, into your spine. And maybe you'd lift your feet an inch off the floor like that with your knees bent. Tighten in like crazy. Don't let the back lift up. Avoid that back arching. Lift and lower. Lift and lower. Lift and lower. And that's going to be enough for you to work and strengthen your core. And then if you're doing the straight leg version, you would reverse in, up, down. Scoop your core tight. In and up and down. In, up, and down. Use your core. Keep that low back on the mat. And 6. Back is long. And 5. Back is long. 4. And 3. 2 more. And last one. Now hug your knees in. Do a little release. Inhale, exhale, release, release, release. We're going to come up. Twist to the other side. Okay, here we go again. Since I did it all the way down for most of the exercises, gotta have my candles. My light. There we go. So now you're going to come all the way down. If you choose to do everything up, it's harder on your shoulder girdle. Keep those bottom ribs lifted. Keep the chest open. Avoid collapsing. Collapsing looks like that. It's sloppy and it hurts later. We don't want that. We have to be supported and protected. All right. We're going to come all the way down to the mat. And then the first exercise, think of hips secure. Bring space between rib cage, hip bones. And we're going to have our legs be straight, vertical, single file line. Careful not to roll the top hip back, shoulder out of ear. You're going to lift and down. Maybe it's going to be a small lift like that. Lift and down. Keep pelvis stable. Lift and down. Knees pointing straight ahead, parallel. Lift and down. And 8. Maybe it's going to be this high. Maybe it's going to be this high. 7. And 6. Lift and lengthen. And 5. 4. And 3. Strengthen those hip abductors. 2. Last one. Now, as long as it doesn't hurt your knee, twist the femur bone. External rotation, baby bit. Lift and down. If that bothers your knee, then stop. Lift. It's happening from the top of the femur bone. And lift and down. Shoulder out of ear. Lift and down. Space between rib and hip. Lift and down. And 7. Use your core. Tighten it. And 6. And 5. Control. Hips are stable. 4 more. and 3, and 2. Last one. Okay, now keep the space between ribs and hips. You could stay down on your mat, or you can prop up. And then we're going to go ahead and do those circles. You're going to lift those bottom ribs up if you're up, and then you would control, and you would just circle. Those bottom ribs lift, your shoulders are in alignment, ribs are straight, and 8. I hope we did this on the other side. At this point, I can't really remember, so if we didn't do this, if we do it now, go ahead and turn over and do it on your other side. Even out. And inhale, and exhale. Those bottom ribs lift. Scoop your abdominal wall tight to your back. And 7, stretch that leg long. Outer hip, inner thigh. 6, outer hip, inner thigh. 5. If you're just starting out, maybe yours looks different. Maybe you're here and you're doing a baby circle, and that's great. That's where you need to be. 4, stabilize hips. That's what it's about. 3, it's not about how big your circle is. 2, it's about your hips are still. They're not moving. Your leg moves, but the hips do not. Reverse. Bottom ribs are lifted. Chest is open. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Control. And 8. Wrap those ribs, scoop in. 7 and 6, brush the leg. And 5, use your core. Maybe it's here. 4 and 3 and 2. Last one. Good job. All right. Roll down onto your back. And we did the figure 4 on one side, so go ahead and repeat it. Cross your ankle, the leg that was on top, the leg you just worked, that crosses over the knee. Flex your feet to open those hips. Reach under that thigh and just hold it here. And if it's more comfortable on your knees, just keep grounded. You don't have to lift up. If you just had knee surgery or anything, you would just stay grounded. Give yourself more support. Keep the spine long. Or you would hold here like that. Breathing in, breathing out. Release your back. Breathing in and breathing out. Release that hip. Lateral glute. Flex your feet. Two more deep inhales here. And last one, deep inhale and deep exhale. All right, gently release. And then you're just going to do 5 circles, hip opener, knee stirs, keep pelvis stable. 3 and 2. Last one, reverse. That back is lengthened into neutral. 5 and 4, keep pelvis stable. And 3 and 2. Last one. All right. Now from here, roll to your side. Slowly press up to a seated position. And then I'm going to give you a little neck release. And then if it's uncomfortable on the knees, you can have your legs out in front. Do whatever feels right for your body. If it's not comfortable to cross the knees, you could have the legs bent slightly like that, whatever you need to do to be comfortable. So we're going to just see what suits you. And then you're going to take an inhale, lift up. I'm changing my mind what I'm doing as I go. Shoulders lift, shoulders lower. Release tension for 4 more. Shrug the tension out. 3, release through your fingertips. Shoulder shrugs. 2. Inhale, exhale, release. Last one. Gently bring head to one side. Lengthen, avoid putting undue pressure, just a little bit. Anchor points this shoulder. Feel side and neck lengthen. Breathing in, breathing out. Release the side of your neck, that sternocleidomastoid muscle. Breathing in, breathing out. Slowly turn. You're going to look under your armpit as long as that's okay on the neck. Slowly come back center, release. Let's do that on the other side. You're going to bring hand to side of head. Slowly drop to the side. Elongate. Anchor points that shoulder. Breathing in. Breathing out. Release any undue tension through those fingertips. Stretch the side of the neck long. Slowly look under your armpit if that's okay. Gently come back. Now from here, what I want you to do a little side stretch. Maybe it looks like this. Maybe you rise up, rise up, rise up. Create length on each side of your waist. And then maybe you just come right back like that. Do a few like that. You just rise up, rise up, rise up. Stretch side of waist, come back. Maybe it feels better to just come over and stretch and elongate shoulder out of ear. Stay here if that feels better. Keep grounded through your sits bone and stretch this whole side open. Breathing in, breathing out, little side bend, lateral flexion of your spine. Keep that sits bone grounded. Make sure you avoid hiking your hip up because we don't want to compress our spine. Breathing in, breathing out, come up. Now, root down, rise up, shoulders relax out of ears, stretch up, 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 up to the side. Get your length, decompress spine first, then go over. Inhale, exhale, get your length before you do the side bend. Very important, so you decompress your spine. We don't want to add compression to it. We want to decompress, so sink into your sits bones, rise up. Maybe it's more comfortable just to hang out here. This is my tighter side. My hip wants to come with me, so I'm careful not to hip hike. I'm careful not to scrunch my side together and inadvertently create damage. So I'm just trying to pull apart, lengthen up, rise up. Breathing in, stretch apart, stay here, breathe. Get those ribs to lengthen away from the hip bone. Decompress your spine. Inhale, exhale, stretch apart, stretch apart, stretch apart. Open that side. One more deep inhale here, and slowly come back up. We're going to do a little neck roll. Any pain in the neck, of course you'd stop. Chin down, roll to one shoulder, chin down, roll to the other shoulder. Two more. Release the sides of your neck. And last set, going from side to side. Alright, so hopefully you feel a little better, decompressed. You got your core working, your low lumbar spine stabilized, and then strengthening those lateral hips and glutes, which is very important also for the lumbar spine area. So I hope this helped, and I will see you again hopefully soon. Bring hands to heart, feeling peaceful, grateful for this moment in the present, here and now. One more time, deep inhale, reach arms to sky, bringing in positivity, releasing any stagnant old energy. Hands to heart, feeling grateful, peaceful, blessed. Thanks everybody, take care, see you again soon. Awesome, thanks for joining me, I so much appreciate you. Peace everyone, bye. Bye.